Hi everyone, welcome back to my channel. So this week I started my geriatrics rotation, so I just wanted to come here to share with you a little bit about what I experienced, what I've learned, and hopefully share some tips with you that can help you further yourself or better yourself in your medical career. So geriatrics means old people, so the care of old people is my rotation. And what we did was we had outpatient clinic, which is just not in the hospital but in an office visit. And then we also visited nursing homes or SNFs, skilled nursing facilities. How I'm trying to conquer residency is writing down certain topics that I find are really relevant during my week and then reading up on those topics when I get home. So I saw a lot of anxiety, depression, and basically mood disorders out in the clinic. And then I saw a lot of dementia and basically end-of-life care in the skilled nursing facilities. Actually, my grandpa was in a nursing home, I believe, after his second stroke. So coming there kind of made me feel a certain sort of way, you know what I mean? It's really hard because I had this one experience where you would meet your patients and they're still with it, but you have to tell them that you don't feel that there are any interventions that will help them get any better. And so they have the choice of going on hospice. And what hospice is just a program that they can get onto to help them accomplish any goals that they have. And they have a life expectancy of around 6 months. Not saying that they will have to die within 6 months, but they have a life expectancy within 6 months. And so those are really difficult conversations. So I feel like a big theme around this whole week that encompassed all these experiences that I've been having was communication. I feel that it's such an honor to be a physician just because you build that patient-doctor relationship and you see your patients when they're sick, at the end of their life, when they're vulnerable. You know, these are when your patients are the most vulnerable, and I feel that your actions and your words had to reflect that. I feel like communication is really important just because you might know all the right things to do, the right ways about going to do them, but if your patient doesn't receive that, and if your patient feels offended in any way, or it actually inhibits what you can do for them. So my tip for you is practice your public speaking skills. Try not to say filler words like and. And I feel like I still have a really difficult time with public speaking because I get really nervous. And in residency, you're supposed to give presentations. So after every time you see a patient, you're supposed to give them a verbal presentation. So you spend 10, 15, 30 minutes to an hour in a room talking to your patient, getting the patient history, figuring out what's wrong with them, making your assessment and plan. And after that, you have to sum all that up within 2 minutes to talk and tell it to your physician. Just if you do it now, I feel like it's really good practice for the future. Just work on your public speaking skills and really concentrate on not saying things like because I remember going to watch lectures sometimes or a presentation and I would just stop listening after a while because I would just start counting how many times people said or and. I know I'm not perfect, but I'm really conscious of that now. In medicine, I feel like it's so weird because you pay all this money to learn the medical lingo. And you're expected to speak a certain way when you're with your physician or with your physician colleagues or with your attending or the person looking over you. You're expected to speak medical terminology. You're expected to speak a certain way. And then when you're with your patients, you have to speak in a totally different way in order for them to understand and in order for them to receive you and in order for them to build that bond with you and not feel offended and make them feel like you're on their side. Does that make sense? You have to basically be two people, and that's what's so hard. So you guys know that English is not my first language. I actually grew up learning and speaking Vietnamese first, And so I feel like I still have this lisp. So what I've found that works best for me is just engaging in conversation and speaking out loud and just being conscious of myself saying and and if you can, even try videotaping yourself and watching it back. I know you're gonna cringe the first few times you watch it, but I feel like this exercise will actually help with your speaking skills or public speaking skills. And what I've found that helped me in the past is reading books and actually listening to audiobooks, because there are certain words that I can't read, and when I listen to the audiobook, it actually helps me pronounce the words the right way. And I'm actually partnered with Audible. They have hundreds of ebooks available to listen to. If you use my link, audibletrial.com/JennaLay, you can get a free 30-day trial. I'm currently listening to The House of God. Everyone recommends this book as a medical student, as a pre-med student, even as a resident. And what this book is, it just shines light on the life of a resident on the ward. I think this gives a better picture of what resident life is really like as compared to, say, Grey's Anatomy. I'll leave links to that in the description box down below. So that's what I've been seeing a lot. I've been writing these topics down and going home and reading about them for 30 minutes to an hour, but it's really hard when I have Wyatt and I just want to spend time with him. So yeah, that was my week. If you guys have any questions, please leave them in the comment section below. Tell me what you guys want to see or want me to talk about in my future videos when I go on these certain rotations. And yeah, that's it. If you like this video, please give it a thumbs up. If you haven't already, please subscribe, and I'll see you guys next time. Peace.